Thank you, sir. Requesting Dr. Kaptan Singh Sehrawat, the President of ICMLS, to deliver the keynote address.
Respected Honorable Chief Guest of today's function, Dr. M. Srinivas, sir has an important meeting, so he's there in meeting. Padam Shri, our guest of honor, special guest of honor, Padam Shri, Honorary Brigadier Dr. Arvind Lal, Executive Chairman, Dr. Lal Path Lab Limited. Shri Karan Singh Ji, Additional Director, Administration, AIIMS Delhi. Dr. Sudeep Datta sir, Head of the Department of Lab Medicine, AIIMS Delhi. Mrs. Saroj Singh, Organizing Chairperson. Mr. Indresh Kumar Singh, Organizing Secretary of this conference. Head of various lab departments from the AIIMS, faculty members, my organizational colleagues, delegates and dear students. First of all, I on behalf of the organizing committee of ICMLS 2024, welcome you all in this National Conference of Indian Medical Lab Professionals. I extend my special thanks and gratitude to our esteemed chief guest and distinguished guest of honor for accepting our invitation and gracing this event despite their busy schedule, sir. Sir, as we know that medical lab profession is a multidisciplinary area of health sciences. This national conference is a great opportunity for all working medical lab professionals like medical lab technicians, medical laboratory technologists, laboratory scientists, from government to private health sector, including the student, faculty members from academic institutions and healthcare establishment all over India. Sir, we strongly believe that in the era of health science, modern era of health sciences, every healthcare professional is equally important, and it's a teamwork now in healthcare. Nevertheless, it is also a fact that we as medical lab profession and professionals are at crossroad in healthcare system. Every healthcare professional and patient has to pass through this crossroad. When we say this, that we are at center of healthcare system, we have substantial reason to prove this statement. With due respect to all our other allied healthcare professionals, let me justify this statement with few interesting facts about the medical lab profession and professionals. In evidence-based healthcare system, no medical degree course, whether it is allopathic, Ayurvedic, homeopathic, Unani, Siddha, or etc., or any recognized system of medicine, is complete without the basic understanding and knowledge of lab sciences. Sir, no allied and healthcare program nowadays is complete without the basic understanding and knowledge of medical lab practices. No allied health course curriculum is complete without the basic understanding and knowledge of medical lab sciences. No evidence-based healthcare system can work nowadays without the support of clinical labs. No specialty or subspecialty can work without the support of labs. So majority of experimental medical or clinical research activities in medical colleges, research institutions are undertaken in lab with the support of medical lab professionals. This is a big workforce of medical lab technologists and scientists working in India Premier Health Clinical Research Agency, ICMR and CSR also. So we are part of teaching, training, research of medical, nursing, allied health sciences. We are also part of basic health services to super specialty healthcare services in the country. Sir, we are proud to say that we are part of all major national healthcare program in the country. This is really a very diverse, complex, yet very comprehensive area of healthcare sciences, where more than 20 different departments and divisions exist, which has very diverse work environment, like microbiology, biochemistry, blood banking. Every department has a different work environment and require distinct competencies and skills. This means that laboratory technology professionals are required to be competent in all major area of laboratories. Sir, likewise any other, this profession has also many challenges and opportunities as well. On this momentous occasion, I would like to take this opportunity to present a brief overview of this profession. It is just a brief SWOT analysis of profession, presenting its strengths, weaknesses, opportunities, and threats. Sir, this is also in line with our theme of this year conference, where we wish to discuss about our professional challenges and opportunities to navigate the future of this wonderful profession. When we talk about our strength of this profession, it is an established fact that majority of our clinical decisions are now based on the medical laboratory results. Clinical laboratory diagnostic is an utmost important area in healthcare, and without the laboratory support, the diagnosis and treatment of the disease is difficult. So we are the largest workforce after the doctors and nurses in the country. It is also a very fast growing sector. If we talk about its growth and expansion, it is also in the context of Indian diagnostic market, the total diagnostic was valued at about 13 billion in 2023, and out of which the diagnostic laboratory services size was 8 billions, which is expected to grow twice in its current size by 2028. Some of the important factors responsible for this growth in laboratory diagnostic are rising number of chronic disease, aging population, and the increase in adoption of number of government insurance program. Moreover, an increase in the awareness among the Indian has also resulted in regular health care checkups, resulted in regular preventive health checkups. So this is also a good factor that in average cost in such diagnostic test in India is lower in compared to other developed countries. Diagnostic services are now more accessible even at home because of the technological innovation and free diagnostic services initiative of the central government under National Health Mission. Nevertheless, we have also few challenges also in this profession. It is a fragmented and unregulated sector primarily covered in the urban areas. Unregulated landscape in point of care diagnostic is creating a challenging situation in patient care. And when we talk about the quality, it is also a hard fact which we have to accept that less than 1% laboratories are fully accredited through ISO 15189 quality standards. So reasons may be different, administrative, technical, and logistics, but this is also a fact. Although we have a central act, NCHP now, but due to absence of rule which are in process of framing and regulation, there is no mechanism to regulate the professional education and practices of medical lab professionals. Sir, thousands of educational institutions have been mushrooming across the country just to earn the profit without any basic requirement of these institutions. Thousands of labs are also running throughout the country without any control, which is a serious threat to the patient safety. These are the serious concern areas for our fraternity also. Due to non-implementation of the central act, whether in government sector or in private health sector, we are facing a plethora of problems. For example, despite of having a proper professional qualifications, we don't have a license and registration to work in profession. We don't have recognized position in hierarchy for identical work. There is no uniform rules of recruitment, service conditions, salaries, and allowances. Sir, we understand that primary objective of this scientific conference is to discuss about the latest scientific development. Nevertheless, we consider this an golden opportunity, in fact, for us to make our policy makers, stakeholders, to apprise about the role of medical lab professionals and the impact of having these dedicated professional on the overall patient care services. This is also an opportunity to highlight the key policy issues related to our profession. Sir, we as an association are putting all sincere efforts for improvement of the quality of professional education and practices in the country, throughout which should be there through a regulated system under the central government. Within a short span of time, we as an association had set various professional milestones. BMLS and MMLS course curriculum was approved by the ministry and recommended to the UGC also. All the health institutions have been asked to implement the curriculum. ICMLS was the important stakeholder in that process. And I am proud to share with you, Dr. Lal was also the lead in that committee also. Thank you, sir. So as far as the appreciating role and contribution of our members, we have few ICMLS awards. For in that, one award is for the outstanding professional who is doing outstanding work in research, then in academics, then in leadership at organizational level. So we have many awards to recognize their contribution. Sir, we would like to believe that in changing regulatory landscape, this is a high time when our central and state government, lawmaker, policymaker, and employers should consider this a top agenda for standardization of allied health education and practices. At the same time, this is also a good time for all allied health professionals, including medical lab professionals. They should come forward to deliberate upon several important common issues of profession, leaving aside their personal grievances of salary allowances, etc. Sir, we have high respect for our medical professionals who are also the team members in the lab practices and leading various departments. Yet it is also a fact that medical laboratory sciences are incomplete without the technology, and medical laboratory professionals are those who are translating MLS science into practice through technological competencies for timely and accurate diagnosis of the disease, even treatment of the disease. If the opportunities are given to them, these technocrats can be a good partner, strong partner in coordinated development of health, education, and services. Medical lab professionals can play an important role in reducing the burden of doctors in many areas who are presently associated in many other activities like testing, teaching, research, and administrative, rather more in administrative activities. So if the opportunities are given to this trained, qualified workforce, the workload can be reduced. Last but not the least, we strongly believe that collectively we can make a big change for the overall improvement of healthcare services for better patient care in the country. With these words, I once again would like to thank you very much for your kind presence here, sir. Thank you.
Thank you, sir.